Greetings, folks. I've had a couple conversations with people over the last month or so that really led me to believe, man, I need to create this video, write this article. I need to put this message out because um, I was speaking with two different people, one with a legal background and another one with an economics background. And both of them, as we were discussing healthcare and the complete mess that is American healthcare in so many ways, they both made the assumption that, well, at least insurance carriers are on our side in that insurance carriers want to keep costs down, keep claims down so that we can sort of, do something to help rein in these costs. And I realized, I'm like, whoa, that is a flawed assumption that's incredibly logical. But then as I've pondered this topic for for weeks and come up with this message, I wanted to go through and show you, no, in fact, every single macroeconomic stakeholder in the entire healthcare chain is motivated by keeping you eternally sick and on medications, not curing you. That is not the answer. Every single stakeholder except for one. There's one stakeholder in healthcare that truly benefits at a macroeconomic level the healthier you get. So I have to start with a disclaimer. Look, this is all about macroeconomic incentives in this video. I am not attacking any individual at all. I know that within every industry there are great people. I work with them. I get to spend time with them. I get to help employers get out of this system with great people in insurance carriers, great people in stop loss, TPAs, PBMs. Great people all throughout at hospitals. I get to work with really fantastic people. The problem is there's too few of them. And the problem is they get absorbed into and by the iron law of bureaucracy. And if you've not heard what that is before, I have a formal definition down below. But it's the principle that in any bureaucracy, the goal is always noble. The goal is to cure cancer or to fight childhood hunger or to provide equal rights for people. But what happens with every single bureaucracy over time is that the primary goal becomes perpetuation of the bureaucracy instead of really adhering to that goal that the bureaucracy was formed to fulfill. Now, again, there's great people everywhere. I blessedly am so thankful that I get to work with them. But that's my disclaimer as I go through all of the macroeconomic incentives within the entire healthcare chain, and you wonder why we have a healthcare cost problem. So, insurers, the trigger point that caused me to make this video. Look, I get it. Historically, you would think about the fact that, well, they're charging me a premium, so they have a fixed income on my employee group this year. So obviously, they want my claims to be as low as possible. And that certainly was true in the past. 15, 20 years ago. I think there was definitely truth to that. Absolutely. But there's two things you have to consider. One, if claims are just constantly reducing over time, is that a good thing for the insurance industry? Probably not, right? Because they're not going to be able to increase premium over time. And as you've seen it, whether it's Wall Street, whether it's private equity, publicly traded firms, obviously, growth is the mantra. Growth is their cocaine. Growth is all everybody's about at the highest level. So you can't grow if claims are constantly shrinking, right? So there is this, and another example an economist actually gave me was, imagine you insure ships that are sailing from America to China, right? Big barges, right? So you've got this giant policy with maybe somebody like Lloyd's of London. Well, if no ship ever sinks, if no ship ever runs into an iceberg, if no ship is ever taken over by Somali pirates, then that premium is going to shrink over time. You're just not going to be able to charge much premium for that risk. However, if ships are constantly going down, constantly getting taken over by pirates, then your premiums are going to grow. And as an insurance company, you're going to underwrite for that. You're going to grow. You're going to make more money. So the idea that, oh, no, insurance companies would want us to be healthier, it's actually a flawed idea. They really don't. Maybe in a year-by-year basis, they might have. But over time, it shrinks their industry, and it's not what they're about, right? Now, it doesn't matter because point two is that the Patient Protection Affordable Care Act, the fun law, otherwise known as Obamacare, absolutely obliterated any chance of this ever because Obamacare put in price controls. And I'm going to oversimplify this for this illustration, but it's called the medical loss ratio, the MLR. And what it says is that state by state, an insurance company must spend 85% of the dollars it takes in on medical claims, meaning the insurance company only gets to keep 15% of the dollars that it charges for overhead, right? And that 15% has to pay, has to pay their rent, has to pay their salaries, it has to pay their expenses, their taxes, pays the brokers, it pays everybody. So they're basically on a state by state basis, insurers are locked into a mindset where they're only going to get to keep 15% more than claims. Okay, so how do they grow? They only grow one way, when claims grow, right? It's that simple. I mean, if let's just another silly example I made with before is that if you say to your 12-year-old son, Junior, you're only going to get to eat 15% of that bowl of ice cream. Junior's going to say, I'm going to need a bigger bowl, Dad, right? So again, not talking about individuals at any given insurance company, talking about the macroeconomic incentives. We've got this situation where more claims equals more premium, even before Obamacare, but Obamacare absolutely guaranteed it, that insurance companies have very, very little interest in keeping claims costs down. So what are some of the side effects, right? As one of my teachers years ago taught me, no good deed goes unpunished. So what are the side effects of this? Well, insurance companies have very, very, very little motivation to guard against fraud, to improve systems, efficiencies, technologies. All that stuff is kind of like, whatever, we need claims to grow so we can grow. And guess what? The crack cocaine of Wall Street and private equity is growth, growth, growth. The faster, the better. Okay, so hospitals. Yeah, obviously, right? Hospitals don't care if claim costs are down. It allows them to bill more. There's no mechanism where a hospital says, gee, I want you to be healthier and come in for less surgeries. That's just not the reality. So, but the collusion that goes on, the oligopolistic behavior between the hospitals, the government, and the insurers is quite draconian. So with a wink and a nod, effectively what hospitals do is they charge about 6 times what Medicare would pay, and then they label that as their charge master, their retail pricing. Now, this is despite the fact that I've worked with numerous hospitals over the years, and virtually every single one of them tells me behind closed doors, not publicly, yeah, we could make money at Medicare. We'd have to be more efficient. We'd have to tighten our belt straps. We'd have to do things a little differently, but we absolutely can make money at Medicare rates. All right, fine. When we're talking reference-based pricing, different video, we don't pay at Medicare. We pay at 125, 140, 160% of Medicare. Find me the hospital that says they can't function at 150% of Medicare. Anyway, aside. Okay, so this is a great little deal we've got going on here if you're a hospital and insurance company, because the hospital marks it up 6 times what they're taking from Medicare, their largest client. Then the hospital says to the insurance companies, we're going to give you like a 50% discount. Whoa, that's awesome. So employers line up and they say, well, we've got to have those discounts that are offered by the 4 big insurance companies. So we'll pay anywhere from $16 to $25 per employee per month just for the right to access that 50% discount on a number that's been bogusly set at 6 times Medicare. So now insurance companies get to brag that they're driving you deep to 50% discounts. Hospitals love it because they're marking up their pricing so high, they get to make a big chunk of money on the retail market, on the commercial business. And what's effectively happening is you've got this really, really insidious transfer going on, this hidden tax that the public doesn't understand, whereby the 30 or so percent of people that buy their healthcare in the commercial market are commercial meaning employer. The employer market is roughly a third of healthcare at this point. Those people are paying a huge tax. They're paying twice as much as they should for their medical claims so that Medicare and Medicaid and Obamacare and the VA and TRICARE and all those other things can be reduced down to the bare minimum. Hospitals can still make their profit. Insurers get to make their profit. And all of this is happening and has been happening since the late 1990s. This problem's just been exacerbating over time. All right. One other fun thing to keep in, and so the politicians like that. Why? Because they get to brag about how we're driving deep discounts in Medicare. Never mind that 30% of all claims that come through Medicare are fraud or misuse, fraud, or abuse, right? Never mind that. But we're driving deep discounts. Yeah. Okay. So last, another stat that you never hear, and it's important to remember. Hospitals, medical errors, I should say medical errors, are the third leading cause of death in the United States. About 250,000 people die each year because of medical errors. So stop thinking of hospitals as somewhere you need to go all the time, every time something is a little bit wrong. Just remember, after heart disease and cancer, hospitals and the medical system kill the third most amount of Americans. All right. Pharma, I mean, is this one surprise anybody that pharma and PBMs don't want you to get better? They just want you to stay sick, right? I don't think I need to explain much here. I pulled some statistics together for you. A child diagnosed with diabetes can be expected to generate just over $500,000 in revenue for big pharma solely for that one condition in his lifetime. The average American adult fills 12 to 15 prescriptions per year. The newest designer weight loss type 2 diabetes / weight loss drug are these GLP-1s. You've heard the names Ozempic, Wegovy, Zepbound, Mounjaro, excuse me. They all cost around $1,000 a month, okay? Politicians and some of our regulators are very seriously talking about and thinking about how we should just put every obese American on these drugs because they're showing to be so effective at weight loss. I mean, granted, they're brand new. Granted, we don't have long-term studies. You know, don't let that discourage you. We all need a shot because we're fat, right? So quick math here. 42% of Americans are obese. This is $1,000 a month. By the way, if you happen to live in Europe where these drugs are made, it's only about $280 a month. So that's fun, isn't it? We pay the most by far for this drug, for any drug in America. So if we were to put all Americans on Ozempic as an example, we would be increasing our healthcare spend by 37% a year. It would go from 4.5 trillion. You would increase that by 1.6 trillion dollars a year just for that one drug. So I don't think that's a really good idea. I don't think it's a great solution, but it just kind of shows you some of the insanity that's out there on this topic. Politicians and government agencies, I've already hit this, right? But they don't want you to be healthy either. They don't want your claims reduced. Insurance and healthcare are the #1 employer and the #1 lobby in the United States. No other sector of our economy exerts more control over the government. Defense, please, it's child's play compared to what we're doing in healthcare. So federal bureaucracies like Obamacare, Medicare, Medicaid, HHS, the National Institute of Health, Indian Health, and the VA, and I just listed some of them here, folks. There's a much longer list of the bureaucracies, the iron law bureaucracy that have all grown in healthcare. And you know what? Government programs, they're the only one that as they do poorer, as the problem gets worse, they get more money, right? So do you really think the entrenched bureaucracy wants you to get healthy? No, because the other thing about this is all domestic spending, right? This is all just like money sloshing around through the politicians, through the insurance companies, through the hospital chains, through the brokers. And it actually allows a politician to brag on the fact that GDP is great, gross domestic product, because GDP is healthcare spending. Think about that one. It gives the politicians another little lie they can brag about effectively. All right. Brokers, yeah, the industry that I am most closely associated with as a healthcare attorney and a consultant. So look, the problem with brokers is most commonly, overwhelmingly, frankly, they're paid a percentage of the premium. And then a lot of times, some of these nefarious actors are also paid what I call overrides or kickbacks. They're kickbacks, they called overrides, or they're maybe even worse, paid a percentage or a chunk of the rebates that should be going to the employer plan associated with the drugs. So you've got this whole situation where brokers don't really want you to be healthier either, because as your premium grows, they make more. As an industry, man, I know there are free market consultants out there. I hear you. I love you. It's awesome. We're in this fight together. Let's go. But here's the thing. The industry, no. In fact, just as I'm recording this week, the largest brokerage in the United States just bought another one of the top 10. So we've got more consolidation, more gobbling going up, and that just means larger overrides from the insurance companies, less creativity, less agility, less independence. It's all bad, folks. In fact, this is a funny thing about the brokerage industry. They're so embarrassed. We in this industry are so embarrassed about how pathetic we are as a group, right? Not individually, as a group, right? that we change our name every couple of years, right? We were brokers, and then that got a bad name because we were swindling people, and then we'll be agents. Yeah, that's kind of a bad name because then we were swindling people, and then no, we're going to go with consultants. Nah, that's not a good name either. Oh, the in vogue one now is advisor. We're advisors. We're like recommenders, right? We're like whisperers. We just whisper in your ear. We don't do anything. We don't make any money. We just advise. All right. The one I forgot, I left off the slide, is producer. In the industry, we call the sales reps, the brokers, producers. What are we producing? Widgets? Rain gear? Fishing rods? No, we're paying these people to go out and produce more premium dollars, i.e., we're incentivizing them to enjoy the fact that you get sicker and sicker over time. It's terrible, folks. We've got to do better than this. And the good news is there's a group out there that is doing better. All right, last but not least, medical groups. Now, look, individual doctors are like never the problem. Your doctor is not the problem. They don't make too much money. They work their tail off, and they're being hammered by the iron law of bureaucracy. They are not the issue. However, private equity and large hospital chains buying these medical groups is the issue. In 1980, 3/4 of our docs were independent. That dropped to 55% at Y2K, and now we're down to a third independent. It's rough. It's killing us because when private equity comes in, we'll do different videos on that. Google it. Private equity makes healthcare worse. Period. End of story. Everywhere in the chain. I don't care whether it's the brokerage, the hospital, the insurance company, the PBM. Private equity comes in with short-term thinking, maximize profits. It is not about doing what's best for you. All right. Who is the one stakeholder in this world that gives a rip about your health, that wants to bring your claim costs down? It's the employers. One by one, employer by employer, they stand alone as the only ones entirely motivated to reduce cost and keep you healthier. So real quick here, each one of these bullet points could be a whole separate video. In fact, I've talked a lot about them on other videos, but we got to remove insurance carriers every chance we get. I've done a whole separate video on buy as little insurance as you can. The more insurance you buy, the more your sickness becomes their profit, right? So what you want to do is self-insure your plan, or at least buy the highest deductible you can stomach. You want to buy as little insurance as possible. That's right, folks. I'm a healthcare consultant who sells insurance telling you, don't do what's best for my pocketbook. Pay me a fee to show you how to get out of this mess. Don't pay me a commission for a fully insured product if you can avoid it at all costs. Secondly, use reference-based pricing, cash payment options, and direct contracts with facilities wherever possible. It's not always possible in every geography, but it's much more available than you think it is. Again, separate videos on RBP. 3, only work with transparent free market PBMs, preferably those ones that even allow you to control the formulary. So you're not beholden to what they are saying that the drug list should be for your employee group, that you would have a final say to modify that based upon efficacy studies and efficiency studies. Okay, use the government's Byzantine inane rules against them. Use them in your favor. There are things like 501R for low-income members getting hospital care. There's patient assistance programs for RX care. And then there's 340B pharmacy rules for very expensive drugs. If you're not talking to a consultant who is deeply steeped in this kind of thing and knows how to access these different avenues of cost savings for you, find a new consultant. You're paying these people a lot of money, and a lot of times they're just mouthpieces for the industry, folks. I hate to say that. Not all of them. I know some great people who aren't, but if they're not speaking this language, move aside. They're not your friend. Work only with independent disrupting consultants. Okay, self-serving. That's me, right? But not just me. There's others. Again, they're out there. I hear them. I watch them. I'm friends with them. I love them. So you got to get out of this mindset that bigger is better. I want to go with the giant house I've heard of. Yeah, right. That's great. Like, yeah, just have this one giant insurance company, this one giant brokerage, and go to everything at this one giant hospital chain. That's ultimately going to lead us to single payer, folks. And if that's the way you want to go roll that way, you're not for me, and I'm not for you. All right, last and not least, add direct primary care where possible. Again, pay a doctor directly to treat your people, cut out the insurance altogether on that plan. It's, again, not available in every geography. We can do it virtually now, and it's growing, so it's a wonderful tool. This slide is nothing more than everything I just threw at you all on one placemat. Awesome, fantastic. The design team at Team Mahoney, you're fantastic. Brittany, you are amazing. Thank you so much for this. It's a beautiful slide. I've got it all here in one spot. Thank you so much, folks. It was a little bit of a long one, but hey, let's go. I'll see you at, when am I going to see you? Oh, I know when I'm going to see you. Renewal time.